All right, so today I want to talk about vertigo, dizziness, and blood pressure regulation. So, one thing we talk about is blood pressure medication, um, high blood pressure, hypertension, type 1, type 2, asthma, some lung conditions that coincide with some cardio conditions, so we call them cardiovascular health. So what I want to talk about with vertigo specifically is you'll hear from some other physicians that there may be some crystals in your inner ear that are dislodged or in the wrong place. However you take that, that's a good theory. There are some orthopedic tests that we can do called Epley's maneuver that we could actually, it's a test and we could use it as a therapy. But really what I want to get at is why did that happen? Why did the crystals get out of place? What caused your balance to go off? What causes the room to spin? And how that kind of coincides with some cardiovascular conditions. So like I mentioned earlier in a few videos, that our posture, our head forward, shoulders rounded forward, what that does, it closes in on the rib cage, pulls us closer, neck straightens out, so signals from the brain to the spine get dysregulated and cause some funky things to react. So what that means practically is we can't breathe from here. So when you're not getting oxygen into your blood you're not getting oxygen to your brain, so why does your brain tell your heart to speed up? Because it's not getting enough oxygen. So it says, hey heart, let's pump harder, let's pump faster so that we can get more oxygen to the body and to the brain, when all we need to do is sit up straight for as long as we were slouched. So if you've been here since you were a kid, maybe you were reading on the floor or you're on an iPad, to when you're in school and they introduce computers, we're on our phones, so it's tech neck, not text neck, tech neck. So when that happens, we roll in, ribs can't expand, we can't breathe, can't get oxygen. So the doctor says you have high blood pressure. Okay, but why? You ever hear why? You're overweight. So let's go down that rabbit hole. So now you're overweight, you've got high blood pressure. He tells you, or she tells you, you can't get off of this medication until you've lost the weight. 3 months down the road, you've lost a little bit of weight, but your blood pressure hasn't changed because it fluctuates. It's always high, it's always low. It fluctuates up and down. It's never just a even keel, even at our age, which is before 30, in case anyone's wondering. So what do? Well, we have to correct posture, we have to correct the nervous system, we got to retrain your muscles. When you're on blood pressure medication, that causes your cells, every cell, to underfunction. Okay, so when you go to work out to lose the weight, you're more sore the next day because your cells cannot recover. Okay, does that make sense? Your cells can't recover, so you get muscle soreness, and that makes you not want to work out. It makes you not move in the right patterns, hence causing more problems. So we need to work to taper down any medications that you're on. I say that not as medical advice, just from human to human, because when you're handed that medication, such as a statin or a bistolic, are you told when you're going to get off, how long you're going to be on them, if you're going to go up or down in a dosage at any point in time? I don't know, but probably not. I know the people I know have not been told that. They've been told, here, take this, and then I'll see you in 3 months or something like that. And they're never told the risks, the adverse effects, even muscle, that this is going to cause muscle soreness if you do try to lose weight. So we need to work on all that. We need to maybe log your diet if it's a weight thing. Change the food sources that you're intaking, go to a more natural, detoxified diet. We need to exercise more. These spinal exercises are a great start. Okay, you can go to a past video where I do all three of those. We're retraining the spine, retraining all the muscles that have been neglected over the years in the spine. And we need to give you adjustments, no matter what age. You start off as a child with asthma, you're more likely to end up with other conditions, other comorbidities, such as other cardiovascular, heart issues, other lung issues, possibly even kidney or liver issues, because those have to do with oxygenation of the blood, detoxifying, and the liver has a lot to do with cholesterol. That's another road. So if a doc tells you you need to get on a cholesterol medication, why? What is a cholesterol doing? It's not doing anything. HDL, LDL, that's not even cholesterol. Those are proteins. Those are proteins that transport cholesterol to and from places. Why am I taking a drug to lower one of those? Or even why am I taking supplements to lower one of those? It really doesn't make sense. We should look at it from a diet perspective. There's a correlation with if you have high cholesterol, you're not getting enough sunlight. That's why I say when I'm getting sunlight outside, as a couple videos back, that my body is making vitamin D. Vitamin D is literally a hormone in your body that is made from the cholesterol in your skin. It's almost like photosynthesis of a human. Okay, just like a plant, but think human photosynthesis. The body absorbs the sunlight, hits your skin, the cholesterol in your skin then travels and turns into vitamin D via your adrenal glands. Okay, it's a stress hormone. It's like a steroid, a natural steroid. We don't want other steroids. We want to make our own. We need to eat right, exercise, get adjusted, get some sunlight. Good to see you guys.